Hi, my name's Chandler, and today I'm talking to you about how exercise can have a really positive impact for those going through treatment associated with prostate cancer. Now, prostate cancer is one of the most common forms of cancer that can affect males in Australia, and the common treatment options that you will often see include surgery, hormone treatment, chemotherapy, and radiation. Now, today I want to touch on why exercise is so important for those that are going through hormone treatment. Now, hormone treatment is called androgen deprivation therapy, and this form of treatment actually targets the androgen or the male hormones, specifically looking at hormones such as testosterone. Now, testosterone to prostate cancer is like fuel to fire. It really helps cancer sort of grow and spread. So what we need to do with your therapy is to take away the testosterone to limit the growth and the spread of this cancer. Now, this is essential. Often people are prescribed this ADT therapy, but when it's taken away, when testosterone is taken away, it can have negative side effects on the body. A really common side effect is looking at weight gain. So when we have low testosterone, it's very common to see an increase in weight. It's also really common to see a decrease in muscle mass and also looking at fatigue. So exercise has the ability to combat all three of these negative side effects. We know that exercise can help to maintain or keep control of weight gain. It can also have a really positive effect on our muscle mass and retaining as much muscle mass as possible. Exercise also has the ability to improve function and reduce daily fatigue. So you can get up and go to the gym and go to work and do your activities of daily living a little bit easier. The second thing I wanted to look at is chemotherapy, often a vital and essential part of treatment as well. Now, one of the main side effects of chemotherapy is a reduction in bone mineral, and this can have an early onset or an increased risk of developing fractures, bone pain, and osteoporosis. What happens when we go through chemotherapy, there's an increase in bone reabsorption, bone mineral reabsorption. So what we do with exercise is we increase that bone mineral density. So we're counteracting the effects of chemotherapy, and by exercising regularly, we're reducing that onset of bony pain, osteoporosis, and fracture. So really important in that sense. So if you have prostate cancer or a friend with prostate cancer and they're going through these main forms of treatment, it's really important that they understand the requirement of exercise in line with their other traditional forms of treatment to really help them get through their treatment as effectively as possible, and to also sort of combat and target those negative side effects such as weight gain, bone mineral loss, and fatigue. These three side effects can be really targeted with specific exercise, and they're going to help the person get through their treatment and post-cancer help them feel stronger and fitter and like they have a little bit of energy in the tank to get on with the things that they did pre-diagnosis. So exercise doesn't have to be, really vigorous and done every day for an hour. There are some nice set time frames that we can work around, and these set time frames can be improved upon over time. So if we're thinking about exercise, remember that it needs to be done under the guidance of an exercise professional if they have limited experience, and that a little bit is better than nothing at all.